Dr. Mintz, how many people are here with us at TCT 2011?
As of the start of the meeting, we had 11,500 registered. So depending on how much on-site registration, it'll be probably 12,500 or something like that.
How many visitors do you have from outside the United States?
I don't know the exact number of outside the U.S. visitors totally, but in terms of physicians, which we focus on, 80% of physician attendees are from outside of the United States.
Can you tell us what are some of the exciting themes we can expect to hear about at this year's TCT?
I think there's several things. There's clearly a growth of structural heart disease. As everyone knows, the Edwards Sapien aortic valve was approved by the FDA next week, and we'll see probably many more live cases from within the U.S. than we expected previously. So that's one very important area. I think that there's a maturation of the drug-eluting stent technology, and there's a lot of interest in how to use the drug-eluting stents to treat more and more complex patients. Imaging is becoming more and more important. That's an area of interest to me personally. So I think there's just a general increase in excitement about interventional cardiology as a whole, with release of new trial data, some new devices that are coming onto the horizon, and of course the increased globalization of the specialty of interventional cardiology.
Can you tell us, how has the TCT grown since it was first introduced?
Well, if you can imagine, TCT in 1989 were 200 people in the basement of a hotel room in Washington, D.C. And that was the era of new device angioplasty, the first stents and atherectomy devices, and people would bring their prototype products to do live case demonstrations in Washington. It grew by fits and starts, stayed in a hotel room for a while, then it moved to the old convention center in Washington, first occupying a tiny corner and then the whole thing, and now we fill a convention center such as this, or the one in Washington, or next year in Miami. So it's, over 23 years, from 200 people to 12,000 people, it's been a real success story.